Hello guys, welcome back to my YouTube channel Dr. R.K. Medicals. In this video, we will talk about the foramen of a skull. So continue to watch my video at last and never skip this video. If you are new at my YouTube channel, then please subscribe, like and share my YouTube channel and never forget to press the bell icon so that you will get notification of all video uploaded by me on my YouTube channel. Let's start this video without escaping the time. Firstly, we will talk about the jugular foramina. As you can see here that this is a jugular foramina, and the jugular foramen is a large irregularly shaped opening found along the posterior lateral area of the cranial base lateral to the foramen magnum, as you can see here. And the jugular foramina allow for the passage of the meningeal branch of occipital artery, internal jugular vein, and inferior pectoral sinus, as well as glossopharyngeal, vagus, and spinal accessory nerve. Now, we will talk about the hypoglossal canal. As you can see here, clearly that this is hypoglossal canal. Hypoglossal canal is the anteriorly located tuberal passage found in the lateral part of the occipital bone, as you can see here. And this hypoglossal canal allow for the passage of the hypoglossal branch of neuromeningeal trunk and hypoglossal nerve. Now we will talk about the foramen magnum. As you can see here clearly that this is foramen magnum, and the foramen magnum is a large oval opening found along the anterior inferior aspect of the occipital bone. Its margin is formed by anteriorly by the basilar part of the occipital bone, laterally by the both the right and left lateral part of the occipital bone, and posteriorly by the squamous part of the occipital bone. And the foramen magnum allow the passage of the flowing structure between the cranial cavity and vertebral column. There's a structure of the inferior end of the medulla oblongata and its accompanying meninges, vertebral artery, anterior and posterior spinal artery, and a spinal accessory nerve. Now, we will talk about the foramen cicum. Here, you can see here clearly that this is a foramen cicum. The foramen cicum is a small opening found along the anterior middle area of the anterior cranial fossa. The margin of the foramen cicum is formed anteriorly by the frontal crest of the frontal bone, posteriorly by the ali of the crista galli of the ethmoid bone. Now, we will talk about the optic canal. As you can see here clearly that this is optic canal. The optic canal is a tubular passage found at the junction between the laser wings and the body of the sphenoid bone. Optic canal allow the passage for the optic nerve and ophthalmic artery. Now we will see superior orbital fissure. As you can see here that this is a superior orbital fissure. The superior orbital fissure is a large cleft found along the posterior wall of each orbit. It is located lateral to the optic canal, as you can see here clearly, and superior to the foramen rotandum and inferior orbital fissure. Now we will see the foramen rotandum. As you can see here clearly that this is foramen rotandum. Foramen rotandum is a small round and medially located opening found on the each greater wings of a sphenoid bone, and each foramen rotandum extend anteriorly from the cerebral surface of the greater wings of a sphenoid bone to the maxillary surface, and the foramen rotandum allow for the passage of the maxillary nerve. Now we will talk about the foramen ovale. As you can see here clearly that this is foramen ovale. The foramen ovale is a small oval posterior medially located opening found on each greater wings of the sphenoid bone. Superficially, it is located anterior medial to the foramen spinosum, posterior lateral to the foramen rotandum, and anterior lateral to the foramen serum. The foramen ovale allow for the passage of the mandibular nerve, lesser pectoral nerve, and the venous plexus of foramen ovale. Now we will see the foramen spinosum. As you can see here clearly that this is foramen spinosum. The foramen spinosum is a small round posterior laterally located opening found on each greater wings of the sphenoid bone, and the foramen spinosum allow for the passage of the middle meningeal artery, middle meningeal vein and the meningeal branch of the mandibular nerve. Now we will see the foraminal serum. As you can see here clearly that this is foraminal serum, and the foraminal serum is a relatively large irregular shaped opening found along the posterior middle area of the middle cranial fossa. And the foraminal serum allow for the passage of the meningeal artery, arterial branch and emissary vein and the deep process nerve. Now we will see the carotid canal. As you can see here clearly that this is carotid canal. Carotid canal is the anteromedially located tubular passage found in the pectoris part of the east temporal bone. And the carotid canal allow for the passage of the internal carotid artery into the middle cranial fossa of the cranial cavity from the neck, and along with it accompanies the internal carotid vein and nervous plexus. This is all about the foramina of the base of skull. I hope that this video will be knowledgeable for you. Thank you for watching my video at last.